Hello, sanibonani dumelang igama uzandi isibongo umfeka umalwandle lo lwandle kalola lwezibhekane zona sihambela le kude phezulu. Do join. Dumelang, goeiemorgen, good morning. Sanibonani bonjo. Welcome yet again to another episode of Meaningful Conversations with Uzani Vega. This is the podcast, the only podcast that educates you, that inspires you, and yes, of course, will keep you entertained. What will we be without entertainment? So, ladies and gentlemen, you are my graduates today. We are learning a lot. The School of Life is wide. The things that we have to discuss in the School of Life the list is endless. Yet, this month of April, we are focusing on autism. Those of you who don't know what autism is a disorder that is known to be affecting mostly the brain. Whenever a child is born, they struggle to be social, they struggle to communicate. Sometimes they also struggle to be vocal. So today, I am bringing to you a lady that works a lot with the autistic children in the field of health. She is going to introduce herself. Sisi, ngicela uzi introduce.
Sawubona Sizandile.
Hello.
Yes. My name is Noxolo Shange. I am a speech therapist. I'm actually with the Department of Education.
Okay.
Yes, I have a background in the Department of Health where we work with parents and children with autism. So yeah, now I'm based at Umgungundlovu district and I'm a speech therapist.
Okay. So you are a speech therapist within the School of Education.
Yes.
Can you break it down into a layman's language? What is a speech therapist? I can hear speech, and right now we are doing speech because we are talking, but what do speech therapists do on a daily basis when you wake up and say you go to work?
Okay, our main focus is we help people with the communication disorders, people that struggle to communicate. There's a lot of things that could cause communication disorders. Amanye uthola ukuthi people with, you know, when umntwana ezalwa ukuthi developmentally siyazi ukuthi by one umntwana usiyaqala with their first words, usiyaqala learning.
Can say mama, but depending, yes.
The vocab is increasing. But with others, you'll find ukuthi umntwana is now at 3, but still no words. And that is what happens.
It becomes a concern.
Yes, that is what happens a lot with the abantwana bethu that are in the autistic brackets. Uthola ukuthi a lot of them are non-verbal, abanawo amagama abawashoyo. So other times you'll find ukuthi umntwana was developing normally, bekakhuluma yenza konke, and maybe through ama-seizures wagula umntwana athola ama-seizures, uthola ukuthi selahlekelwa i-speech sakhe akasa-communicate. Uthola ukuthi even an adult mhlawumbe ukuthi ube ne-stroke, uselahlekelwa ilo tungana ama-communication skills zakhe. Sometimes when we talk communication, we're not just talking
speaking only,
referring to just speaking. We're also talking to understanding, some receptive language skills, social skills.
Or more like it's normal that when a parent is playing with the child will respond back.
Yes.
But when you see that your child is not responding, maybe you're playing with the child, no, and the child just looks at you.
Yes, and when you
or don't even look at you.
Yes, and kunama skills that come first before the actual speaking. Those are called pre-linguistic skills. Skills like eye contact. That is a communication skill. So
especially to mothers who breastfeed, it's normal that they make eye contact with this. So whenever the child is not making that contact, it becomes a concern.
Yes, like joint attention. You are referring to breastfeeding. So there's a joint attention. We are both focused on this activity together. It could be through playing. You are playing with toys. We are both focused on this activity. And with a child that has autism, sometimes they struggle with joint attention. They prefer isolated play.
Okay.
They prefer playing by themselves. They avoid the eye contact. So those are all the communication skills that we help AMA learners with, and sometimes AMA adults as well. So that's what I do as a speech therapist. I help a learner communicate better.
Okay.
It's not always, I know a person always thinks, my child is going to talk. Some learners or some children that are autistic never speak. They become non-verbal adults, and we look at other means of communication. Because when we're talking communication, we're not only referring to speech. Written is written language.
They also struggle to write as well.
Some.
Oh, okay.
Some. Not all. Others write well. So when we're talking to communication, we're talking to written languages. That is communication, because I can, if I'm struggling to communicate, if I'm struggling to speak to you, I can write.
Yes, it's another form of communicating.
A computer, I can type something, and we use a lot of other devices, especially like
and hands as well. So they also use hands.
Yes,
okay.
They use sign language, Makaton. They respond very well, especially our learners in special schools. We use a lot of Makaton, which is a symbol.
What is Makaton?
Makaton, it's a symbol that uses hand gestures as well.
Or more like the people who can't speak.
Yes, we use it with.
Is it the same as the sign language?
There are similar gestures or signs, but not 100% the same.
Okay.
I think about Makaton is that it uses the hand or the hands as well as pictures.
Oh,
so
okay.
It goes together. So you'll find that there's always a picture together with the hand.
Okay.
Yes.
So now, as you are employed by the Department of Education, do you categorize different types of autistic kids or learners?
I'll say yes, they are learners, because when we're talking about autism spectrum disorders, it's a spectrum. They are learners that are high functioning. You'll find that a learner has autism, but their intellectual functioning is normal, meaning that their IQ is normal. Those learners you'll find in mainstream school, they don't
need to be taken to a special school.
Yes, because their intellectual functioning is normal. They can go up as 2 matric. But then you'll find learners that have other co-occurring disorders, such as maybe behavioral problems. So now they're struggling. They have behavioral problems. Others have an intellectual disability. With intellectual disability, they may be slow in processing some things.
So they cannot be put in the same class. If you are a grade 7, you cannot be in the same class as grade 7 because your learning process is slower than the other kids.
Yes.
Okay.
And then you'll find that there are learners that they need a lot of supports, high levels of supports. Those learners, you'll find that they still need help with using the bathroom. They need help with brushing their teeth. With daily activities.
Normal daily routines.
Yes, they need a lot of supports. So that's how you'll group them, in a setting which this one goes into. But we use a lot of like our psychologists assist in terms of assessment, because they are the ones that would diagnose if there's a co-occurring intellectual disability. Because if a diagnosis is saying autism, it doesn't necessarily mean the learner needs special schooling. It's as you said earlier, when we speak autism, we're just referring to difficulties with social interaction. There's difficulties with communication, and sometimes there's an obsession with some repetitive behaviors. But now, when we're talking to learning or schooling, now a learner can have a normal IQ and can cope well in a mainstream. However, others you'll find that they do have learning disabilities or intellectual disabilities. But a trained psychologist helps us in terms of identifying where the learner is functioning.
Now I'm thinking, in a school that is in deep rural Ingandla, do you reach to those schools as well? Do they have speech therapists that are based in those schools that can actually help learners that are identified as autism? Because I'm asking this in an African perspective, that most African setting, we usually think that, I'm not saying this to offend anyone, but it's the normal language that Africans use. They usually say, umntwana ohlangayo.
Yes.
Which is not the true definition of what autism is, and they also hide them. So now, how do you reach out to these kids who already have labels in the community, and apart from labels in the communities, most families even hide them?
Yes.
How do you reach out to that minority?
Okay, so you're referring to the rural setting?
Yes.
Okay, I think support is first found in clinics and sometimes hospitals. That's the first support. That's where the learners sometimes get, if the parents do bring this.
Take them to.
They go for a monthly, what do you call them?
Immunization.
Yes, that's sometimes through that screening. If that is picked up, that's where they got their first support. you do get therapists, psychologists in hospitals. So that's where you get support. That's where it's first picked up. However, sometimes it's not picked up at that level. So till umntana zabe school going age,
sometimes they say, oh, this is a slow baby.
Yes, to a school going age. In mind, this has never been identified to the umntana onenkinga. So, but there is a policy called education which is screening, identification, assessment, and support.
Okay.
So we try, especially as office-based officials, we try to support schools in terms of, especially educators, in terms of how to screen learners, identify if the barriers that the learners might have in terms of learning, and when we identify then assessment, and how do we support them. So that's where, especially in a school setting, that's the document that, or normally that's the process that needs to happen. Educators need to learn to identify that this learner is different in terms of how they are learning, on how they are from other learners. That's where it first starts. And then when an educator...
So the document identify the processes.
The educator would screen the child. This child is experiencing barriers in learning.
Oh, so no, what I was trying to say is that the document that you say the policy identified each and every process that needs to be followed if the teacher identifies things, because they are not trained, isn't it? But things, or what happens there? What happens in the process? When do that policy starts getting implemented? At school or before a child starts school?
At school. So as
okay.
soon as the first 2 weeks, they are screening all learners in the school are meant to be screened by their educators. Because we all need supports, different supports. How about you talk to visual problems? They need to sit in the front. We're using the CS process to screen. This is how we can support this.
Oh, this is a standard policy just within not that it's specific to... okay.
We are all different. So this one's applied to how can we support each learner.
Each learner.
Yes. So what would happen is that there's a form called an SNA1 form. That's where an educator would assess
the learners in the class.
Yes, how can I best assess this learner? Look at the learner's strengths, the learner's weaknesses. And then after that, there's another form called SNA2. Now, that's where the educator will now refer this learner to the school-based support team. Each school needs to have a school-based support team, something that involves the HODs, other colleagues that are also in the school. So after that, there's an SNA3 where now the school, the school has identified that there's a learner that cannot speak. We are struggling to educate.
To hear what the learner is trying to say.
They now refer this child to us at districts. So at districts, there are therapists, we are there. We then come and assess these learners at schools, and we see if these learners can be supported in that mainstream school, or if now this child needs more support and needs to be placed in a special school. Okay.
In your experience, has it ever happened that there was one learner that was actually referred to you, non-verbal, completely non-verbal, but they ended up being able to communicate clearly?
When you talk about communicate clearly, are you talking using spoken language?
Spoken language. Let us just focus on spoken language for now.
There are learners that do, I have a lot of learners that do learn words, sometimes sentences, they might not speak like
me and you.
Yes, grammatically correct language. They don't follow the correct grammar, but they might learn sentences. I've had experiences of learners, sometimes they learn very late, but they do. That's what we do in speech therapy. We try to increase their vocab. When we're talking about vocab, we're talking about like from your body parts to items at home, furniture, as we try to get them to learn more words.
Even if it means it's repetitive communication, so that you are able, if you are a caregiver of such a child, you are able to understand what they are trying to say to you. Oh, okay. Yes. So now, in terms of the years of schooling, do they go to school the same number of years as the other learners?
Which one? Who are you referring to?
The autistic.
Learners with autism.
Yeah, learners with autism.
Yes, definitely.
They can just go from grade 1 up until grade 12 without a problem if their intellectual capacity is normal.
Yes, we have learners that have autism that have matric, and sometimes a lot of them you'll find that they are genius. Because earlier you mentioned in neurodiversity, their brain works differently from ours.
It is.
Find them, a lot of them are maths genius. A lot of them are very good at a lot of things. They might just struggle with their social interaction, but they are good at a lot of things. Are sorting complicated puzzles. A lot of them are genius. So a lot of them do like very well in terms of science, other fields. But we do have learners that have autism, that have behavioral problems that are hindering, that are barriers in learning. They struggle at school because of this behavioral problem co-occurring ADHD, which is like a behavioral problem. They struggle to sit, to learn. So we do have those.
When you say come again, there's a abbreviation that you mentioned. I don't want anybody to be left behind. Cordial DA.
Sorry.
Cordial DA.
Some co-occurring.
Co-occurring and
ADHD is another disorder.
I want that abbreviation. Yeah. What is that abbreviation and what does it mean?
Okay, it's attention deficit disorders, basically hyperactive disorders. So that's
which means now these autistic learners, they struggle to pay attention.
Not all of them.
Not all of them. A certain category of them might struggle to pay attention, but they are genius, and once they are able to master one thing and one thing on, they are very good at it. Because I'm going to that point where you're saying that they can be maths genius. Because I have a family friend who's got twins. They are both autistic. Okay. They are geniuses in maths. Okay. Which I've also picked up on as I was doing the research about this podcast for the month of April, as we're focusing on Autism Week, on the autism awareness, excuse me, that they are genius and they are good with computers as well.
Yes, we do have a lot of those. They just need a lot of support. And when they are placed in the right environment, they excel. So it's all about, I think, for us as officials or sometimes as educators, as people, family members, for us it's just to identify their strengths. As Nakuba should do, they are good with computers. That's the support they need. They need to be supported in that. We just need to identify their strengths, because you'll find that they are good at that, but they are struggling maybe with their social skills. They're struggling to interact with people. They are struggling with their communication skills, but they are good at other things. So that's why I was saying that that policy, that CS policy, we're looking at the learner's strengths and
identify
the weaknesses. Okay. Because we are all different. There are areas where you'll find that we are excelling in, and there are areas where you'll find what we are struggling with.
Now, what happens when you cannot help the child at all?
We always help. What do you mean we cannot help?
In an extreme case where does it ever happen that there's an extreme case where you cannot feel like you have to refer? I'm trying to ask, when you refer to who? What is another level from speech therapy? Will be another level that is above that, in case you feel that the child is really struggling to use any of those that you mentioned? Because you mentioned that there's another form of communication where they use pictures, you use hands, you try different interventions. What happens? Where do you refer to when different interventions are not successful?
I think in the area of the communication, a speech therapist is an expert. There's no one that can help with the communication but a speech therapist. However, we don't work alone. We work with other professionals. We work with occupational therapists who focus a lot on activities of daily living. They'll help these learners in
putting them into a routine. Yes, that's where I'm trying to get to. Keeping them into a routine.
Motor skills. Also cognitive skills. We work with psychologists who, as I mentioned, they are mostly they identify. They are the ones that diagnose these learners as being autistic. We work with physio. Sometimes we find a lot of our learners are struggling with their big muscles.
They grow too fast, isn't it?
So the physiotherapist would work with their gross motor skills. We work with the educators, especially as I'm in a school setting. We work with agents. So there's a bigger team. So we all play our different roles. In terms of communication, as a speech therapist, that's what I'm good at. But there might be areas we spoke about behavior. Behavior is a big one when it comes to learners with autism. They struggle a lot with behavior. When you'll refer to a psychologist that might refer to like a doctor because sometimes they need medication. So we just refer to, like when there's a problem, we just look at the problem and identify who's the specialist that works best in that problem. But you were saying that if there's ever a case where these things don't work, there's always like when we're doing our assessments, we just first we assess to see in terms of receptive language, how is the learner understanding? You might find that we are busy trying to push the learner to be more expressive in terms of how they are communicating, but the main goal should be actually teaching the learner how to understand. Maybe the goal should be more receptive language. Maybe the goal should be focusing more on social skills before jumping into getting the learner to express. So there's a lot that we work on. So that's why our assessment is kind of broad to identify where do we start in therapy.
The proper assessment is the key.
Yes, then we progress in terms of our treatment. Once we've identified an area, once the learner has progressed in that area, then we check another area that we can work on. So I, as a speech therapist, will then have to progress in terms of my treatment. If this is not working, what else can I apply? Okay.
And now in the process where you're trying to help these learners, what is the role of the parents?
Oh, it's the role they play the biggest role. Parents play the biggest role because a lot of the time I see the learner for like maybe 30 minutes to an hour, maybe sometimes once a week, and sometimes in the hospital setting it's once a month. But the parent is with the child every day.
That's true.
So that's why you'll find that, especially earlier we referred to a setting like in Kandla. Umama uyisa umntwana esibhedlela once a month. You'll find the therapist spending a lot of time teaching Uma what to do with the mntwana to try and get joint attention with the mntwana, because the mntwana siyamazi ukuthi uya-isolate-a, ahlale yedwa akathandi uku-interacta nabanye abantu. Mhlawumbe you'll find me as a therapist spending a lot of time trying to get Uma to understand how can they improve this at home. Even nama skills that we are teaching in therapy, they need to generalize, because you'll find ukuthi umntwana uselifundile igama. Let's say in therapy we were just learning body parts. Ukuthi leli ikhanda lami, these are my eyes, this is my nose. You'll find that the child is now saying these words in therapy, but not now using these words at home or at school. It means that whatever I'm teaching in therapy is not generalizing to other contexts. So it's very important that I involve the parent in my treatment, that I involve the educator, so that whatever I'm teaching generalizes in other contexts as well. Okay.
So what I'm hearing is the fact that there is help.
Yes.
No matter where you are located.
Yes.
So basically, the reason I'm asking these questions, I am alluding to your point that it's commonly known amongst African communities that we hide abantwana abanama abnormalities, whether it's autism, whether it's disability, whether it's physical. Do not hide umntwana, because there is help, especially as we are focusing and talking about autism today. There is assistance, and I am going to ask Autism Noxolo to share my details, so that even if it's a neighbor or it's a relative that you have seen ukuthi bayamfihla umntwana because une certain condition, especially if it's you because now you have been educated. We have been doing, we spoke to a life coach, we spoke to 2 of them. Another one also mentioned that they can even help these children identifying from a point of birth up until whatever, they can use their energy to try and heal them. So come out and tell us what is the problem. We would like to hear from you, but at this point in time is the fact that there is help.
There is help. Don't be afraid to tell your doctor. Maybe it's a clinic. Don't be afraid to tell your nurse ukuthi you are noticing these things. Don't be shy. They are there to support you. Don't be afraid at school to bring these talks with the educator. ukuthi my child is struggling with this thing. Discuss these things with the learner's teacher. How can we support?
Awareness.
Yes. Don't be shy. They are there. We support schools. We support these educators for them to support you. So don't be shy to bring it up to educators, to doctors, to nurses, whoever is around you, so that you get all the help that you can get. But there's help. There's definitely help. Department of Health, Department of Education, DSD, we are there to support our parents at home.
I am so happy to hear that there is help, because I have this perception, maybe it's doing the research and streamline it to what you want to see.
Yes.
I had this perception in South Africa there is very little awareness, or there is very little that the health sector as a whole and the education system is doing to assist these children, other than having the schools that are specialized in in the fact that they deal with special, they call them special schools, isn't it?
Yes.
Specialized, so that these children can go and learn there because they are a little bit different than you and I. But I'm happy that there is help, because there is also another lady that I'm following on YouTube.
Okay.
He's got an autistic child. It's a boy. Now he's 14. I started following this lady, I think, about 3-5 years ago. The resources that they have in the US are amazing.
Oh, they're in the US.
Yes, they are in the US. Are amazing. The things that you see that she mentions that it's just the facilities that are provided by the government.
Yes.
You will be shocked. You will think that it's something that she has to pay for, but it's actually provided for by the government, because I believe that maybe that side there is a lot of children who have this condition, but it gives me a lot of ease to hear that there is help for our children as well. Now, for the month of April, as it is, UN has declared that it's going to be an autism acceptance month rather than that awareness week that they only had. What are the programs that we must look out for? Maybe there's somebody at home that is watching right now who didn't know all this kind of information, who got educated today and has got a relative or somebody that they want to help. What are the programs that you can look out for from the government side to attend, or maybe to follow online, that you have for the month of April?
With us, I'd say that I know a lot of our schools that we are currently supporting. They are
Normal schools now.
We, like the program that I'm in, we support special schools.
Oh, okay.
Yes, a lot of our special schools, they are going to be running their own campaigns, and we are supporting them.
Oh,
Yes.
okay.
So
But I think the government must also look into bringing this education to normal schools as well, because there are a lot of dropouts. There might be dropouts from children who are learners who are struggling because they label them as udom, awupasi, ganti.
What I can do maybe is I can find out for you of other programs, and for those that are interested, they can contact me, and I can help them with programs that are currently running this month.
You leave your details so that they can be able to get hold of you. Okay, so Mbugeli at home, thank you so much for joining in on this conversation. I do hope that you have learned a lot about the people who are living with a condition which is called autism. And if you are in a position to help somebody, reach out. It can be a relative, it can be a neighbor, it can be somebody's child that you go to same church with. You'll never know this kind of education. We want it to go far and wide. Autism Noxolo is going to leave the details down below on the description box. Make use of them. And thank you so much for joining in this conversation.
Thank you.
Thank you for having you on the show.